Yene Mr. Kwame Bempa Osei, our communications director for the COVID-19 Trust Fund. In the Mr. Bempa, good morning. Hello, good morning, Mr. Bempa.
Yes, sir.
Good morning.
Yes, sir.
Now, I'm a say,
Morning, sir.
Now, important to say,
Yamia Dumboko.
Mr. Say, and I pay.
Morning.
Ye perceive be sase and ye be ano. In the spirit of accountability, and I'm launching a website so that Ghanaians may know where money is expended went to. And ye be we know so the website was pulled down some months ago. Is it still up or down?
What's why they mean it?
Me say COVID-19 Trust Fund. My website, you know. I confirmed some months ago, and you be about up now.
It's still under maintenance, but then you be your technical hitches crazy.
Okay. But your issues be sir, the technical issues if we may have an understanding of what
the concentration should not be on website. I am with you. If you have any information, I will Bisame. Na mean so mean
all right.
The website is something I shouldn't take the time of this conversation.
Yo, Minia, Mate for the clarity. Now, you didn't come on and I'm a colleague I'm in one say raise concerns about the focus of the COVID-19 Trust Fund at the time. Now, His Excellency the President, what commission was said, Mumbra na Mumbaye Ejuma. So let me read for you. His Excellency the President says that added that the work of the board will complement the efforts being made by the state in catering for the poor and vulnerable, stressing that whatever money we raise, that is the target. Indeed, the target for the establishment of the fund was towards the poor and then the vulnerable in society. But my colleague raises questions about why school reopening for some tertiary institutions and some second cycle institutions should be the mandate, summing up to around 15 million Ghana cedis. Why should that be the focus of the COVID-19 Trust Fund?
You see, I was listening to a gentleman. Sometimes, communicators. Any public discourse no aya yen try say yan kasa e be seeking for further information so that you be equipped na ye kotena baabi na ye kasa na ye hu say sebe enye say bi aya ti bibi won nchen because our medium as media people no we have to educate, inform. That is the basic thing. I was here. There is an act of parliament at 10/13/2020, the Coronavirus COVID-19 National Trust Fund Act. And no, and Omampeni intention or declare say or person setting up the board. No, he went further. Emma Parliament pass an act of Parliament, the novel Coronavirus COVID-19 National Trust Fund Act at 10/13/2020. The act it spells out the mandate and activities was said the COVID-19 National Trust Fund in Oye. Now the two mandates for the trust fund, number one, is to support those who are directly engaged in the combat of the COVID-19 pandemic. Sikana obeji no, you support those who are affected with or infected with the COVID-19 pandemic, especially the vulnerable in society. Ubisa misa denti na school reopening. Ya two tertiary institutions ya Ghana henyi na emu. Ya ba baby school at that time no in the heat of the COVID. Enkola na omuko school na omu ye mba ewo all the tertiary institutions in Ghana. Omuko in the midst of COVID. Omu be here nose mask at that time physical distancing oho. Omu be here thermometer guns ya de be test o mama ye hu say obi wo a ebia ne temperature arise nti ye isolating na ye nhwe say ye COVID a omu be here Veronica buckets omu be here tissue papers liquid soaps a omu de ebe ye adwuma na nti ukai a abra ye bie yo mo open tertiary institutions no you say akola bi a oba bia is entitled to a bia nose mask insia ye be ma ne liquid soap baako ye the thermometer guns akosi a bia central administration obi call classroom obi call lecture theater library ye be test no. The school reopening committee, government was doing its part. They approached us. And then we realized, said, because of this, there may a fault within our mandate. In TSA support to you are asking me, say, why school reopening? Into the students of over 200,000 who were going to school are here PPEs, medical items. You are telling me, say, it was not necessary. Yeah, no, we were created.
All these things you're talking about, the PPEs and co. Was it not something which the Ministry of Education,
I am telling
in partnership
you, sir,
with
we
the
were not the
Ghana
only
Health Service and the Ministry of Health, responsible
government
for?
did its part. The Ministry of Education, Ghana Education did their part. But they appealed to us as a body.
You said the Ministry of Education appealed to you and the Ministry of Health appealed to you.
Yes, the school reopening committee appealed to us. Said they needed even more. But we didn't have what they were asking for. They support to us, so it was support. Yes, through a letter. You can come and have a look at the letter. That is why I'm saying, say, we do media work, we should seek for information. So that when we are speaking, the facts will support it. You may disagree. That one is your right to disagree. But when a board sits down and thinks that tertiary institutions are being opened, and we are a statutory trust fund, your quality seeker free individuals, corporate organizations, tertiary institutions in the country are reopening. Peoples of about more than 200,000 needed PPEs. That's a whole say, and there and COVID-19 National Trust Fund, we believe that it falls within our mandate.
All right. Now,
you can disagree. Somebody was talking about say Argentina private sector fund. Please listen and listen well. We didn't give money to private sector fund. They say,
Me too.
Yes, we didn't give money to private sector fund. They say, and I say, activities. Yesterday, the press conference, the chairperson explained, he said, at that time, we were not a procurement entity. And the law which established said before, answer a major procurement, we should be a procurement entity. So when the board sat down, they said no. At that time, CPP, go back to your archives. Hospitals, senior PPEs, frontline workers, doctors, laboratory testing centers, omuni PPEs. You were calling left, right, center. We had money. So we say no, private sector fund, come and let's sit down. Let us arrange based on an agreement to say, you will procure the PPEs worth this much for us. Go, bring your receipts. When we procure, then we will pay. So they did the procurement for us, and we did our own distribution across the length and breadth of the country. We went to Tamale. We distributed to over, in all, we distributed to over 48 institutions, teaching hospitals, medical facilities, testing centers, 10 million worth of PPEs. And PPE in your car, your medical PPEs are cover-ups, overalls, almost said the isolation center, any testing center, normally disposables.
All right. I think the elaboration but I want us to go back to the core mandate, the two of them that you mentioned. Yeah. The second bit, which is part of the act now, you mentioned. Two, essay. Support needy and vulnerable persons infected with or affected by COVID-19. From the numbers we saw as to the people who have been hospitalized as a result of COVID-19, how many of these people receive support from COVID-19 Trust Fund?
Hospitals being.
We say the Ghanaians, number of Ghanaians who were infected by COVID-19. Your mandate says, you have the responsibility to support this needy and vulnerable persons who have been infected. And you be a data How many Ghanaians infected by COVID-19 did you support?
One kasami bisa unsu and if you was statistics about the number of vulnerable persons
as we speak now, Obia wotie me bia no will realize I'm a bit handicapped because I don't have the information which I previously had on your website, which is not there anymore. And so I'm a bit handicapped in terms of access to information. But moving forward, using your own act, and I'm asking, say, you would have access to the data. Per the data you have, more responsibility was towards the needy and the vulnerable in the society who have been infected by COVID-19. How many Ghanaians infected did you support?
Press conference. You've been able to lay hands on my number and you have called me. And if you say website is not the only avenue to seek information. Are you listening?
Fair enough. I wasn't invited to that press conference.
No, it's not about you being invited to press conference. I'm saying, say, whether you were invited or not invited, you have contacted me.
Yes, to get this information from you.
So you can't say, because maybe website is temporarily down, you cannot have access to information. You know where to get the information.
It's okay, I understand you. But
because
I'm asking.
You search for my number and you have called me.
No worries. So now I'm asking, Opani, how many needy, vulnerable, infected with COVID-19?
We were not created to say, you can't vulnerable, ABA, yanko chiche sika anabibi. But the vulnerable, ya chiche, please, are you listening? If I'm talking and you are talking at the same time, nobody
I
can listen.
I have not spoken, my
us.
brother. You are the person speaking, not me.
Yes. What I'm saying is, supporting the vulnerable in society was not to say.
Hello.
Me
opening.
Me say support the vulnerable. No, maybe your understanding is idea. Nanka yonko chichiska, but. Say, who share a write up na ye dia to ho na. What's that? Hello.
I haven't spoken a word. When I meet you.
Me say supporting the vulnerable no. Ya distribute PPEs, medical items to over 420. No problem. 420 chiefs compounds, small health centers, any medical facilities across the country. The rationale is say, fani say ebia obi wo baby eye ekwe bi ase. Yare nso e baaye no na enye limited to one place. Abra na ekoso no. Nti be say ebia chiefs compound bi wo ho, ana say ebia health center bi wo ho. Na say obi tu America na okoye no e ho na obi detect ehun say ebia oye potential COVID-19 patient ansana omo attend to the person eno da nchen a omo me ayarse adwuma to say nurses, doctors, abia medical assistants omo wo baby a enipa no koye no omo nso they were at risk nti niema na ye chiche ye ne yade a ebetumi aboa na obi hia abia hand glove obi hia abia thermometer gun bia otumi de aye eno da nchen a ye can affected with any infected ya ye wo de yare na kano ena de nam yare no nso ama ebia na dwuma anana de bia say ndi se utie press conference na ye ne ise Institute of Statistics, Social and Economic Research will go. ACI say we needed to identify the poorest of the poor. Through COVID, omoye affected in terms of omoejuma, ekwa na omofa so ye trading ni nema. And ise identify 10,300 individuals in 88 poorest of the poor districts across the length and breadth of the country. Said they have been affected significantly by the impact of the coronavirus. So the where the now can say affected with or infected, the arena channel, and man the arena being channel, now so ebia and am arena so or kwa huchirimu 10,300 individuals and identify 80 districts in the country. And then the board sat down and said, how can we support them? We have to provide at least 500 Ghana cedis to each of these individuals. Not to say you or any name fa a revival or bojua edumebia or moye na senia yare no nam so ebia na oton oye afuo ontimi nkwa afuo mu biem okofa enema kitua bi beton yare ni nti yatum ontimi nko biem. We distributed 500 Ghana cedis to these 10,300 individuals. Eventually, no, because of identification, because it's a phono and normal field assistance, a straight identification through ARB Apex banks. The nearest rural bank, ukra COVID identification card, as a friend is saying, one of the identified individuals. Now the voter, yes.
Medoase for the breakdown. Now help me. What about 10,000? A number of 10,000 recipients. You can answer me. Mami, the ratio of the infected and the affected. My focus is on the infected. As for the affected, that's not where my focus is. The infected people who are at the various medical facilities, what form of help did you offer them?
I've told you, sir, in some cases, people have asked for hospital bills. In some cases, sometimes you think, sir, affected with, no, when you are talking about the infected with, you are, central government was paying for free medical bills for anybody who was infected with COVID-19. And I know Nimsa.
That's why I'm asking.
I didn't go to I say COVID no. I buy an etria.
And it's not me bisa say.
In any demand I buy an etria. So in cases where any pandemic, so that's why I'm saying we needed not to duplicate. And you can say our emphasis is in the infected with, as if we say it will be controlled no enya a year. I buy an etria or moka. And it's a even if you are in isolation center, you are being
fair what you are saying, what you are saying. I have a responsibility to cater for all the people who have been infected by the disease. And yet, your act says, you have a responsibility towards those who have been infected as well.
To do what? You have the responsibility to do what?
Your access, but
when the government is paying for their bills, medication, oxygen supply.
So then your access, support needy and vulnerable persons infected with COVID-19. And maybe just say, what form and how many people did you support who are infected? Forget about the affected people.
That is what I am saying. Say, nipa na yare ni bi action no. I didn't akoto ayare sabia no. Aban ena ehwe no. The medical bills aban na etua.
And it's gonna momo yamo.
Yediniko ICU aban na etua. Those who were even put in quarantine, omo isolation center aban na etua. Enti government say enipa no quarantine na yare ni bi action no. Oxygen supply yede mano ene ne amanema aban na etua. Until say ye benya ye friend saying ye benya information from, let's say, the Ghana Health Service, and I say, oh, ye bi omo aha omo ye vulnerable and needy ye de omo beto no here ABCD e de ama omo aban ensan so enti momomrem senya me kire school reopening de ne kire won say we were approached enti e basa na say we are approached ya you go in.
And how many of such cases?
You are emphasizing on how many and no any information that is available now because we were not duplicating the efforts of government, but rather complementing on the efforts of government. We were complementing the efforts of government. When one government is doing it and it is going through, and we've not been approached, you won't go there.
Yo, Mr. Say. I don't answer the person in the meeting. Come on.